Welcome back. I'm Fiona Mboa here at Church of Uganda Family TV with Ring Diaries, where we talk about anything and everything to do with marriage. And today we're talking about health and marriage. Before we went for the break, Grace was sharing things we need to test before we get married. And now we're getting into the things we need to discuss when we are married. Because the things we were talking about earlier, Grace, were the things before marriage. Now we are married and something crops up. And they always
just having a recap behind of something we skipped. Among the things we're supposed to test were the semen analysis.
Now what is that?
Semen analysis helps you to know your fertility rate.
Oh, the fertility thing.
And it also helps on the sperm count. Like you get to know it.
But how do you go to those things when you're in love? That's the problem.
That's the problem. We are kissing only, which is not the. Like I told you, love is the cherry on the cake.
We need to get into
all this.
But if you bring it up, doesn't someone think this person doesn't love me? Why are they asking about
Actually, if you love
counts?
me, you should even be interested in asking me when we should go. When I tell you we should go and do like a fertility test, a semen analysis, a genetic test, all those things help out. Because imagine, now we are in marriage. And we had never tested. And then I'm wondering, I start saying, I married the wrong person. We start pinpointing at each other in silence. The marriage is dying slowly but surely.
That's true.
You get. But if we had done this test earlier on, and then I had known that, actually, either my fertility rate is not, it's medium, but then, it is good. It is medium, yes. You know, and like, how do I boost what should I eat? How do I boost my fertility? You get. What are the exercises? There are exercises people do to keep pushing their eggs down. Yeah. There are exercises they do to put those coatings they do to push their eggs down. You get. There are some medications people take when they want to get pregnant. So if you know your fertility is low as a woman, you start taking the medication quite earlier than when you're like, okay, now I want a child, but you've not been preparing the body to release the eggs. Okay. Then for the men, if you've done this semen analysis, it shows you how much sperm you release, because men release about 15 million in an ejaculation, 15 of them. But among those 15, it's usually 1 or 2 that hits. So if you have less, and then what are the chances?
Out of 15 million, it's 2. Now what are the chances?
It could be like 2 or at most 10. There are those who have like 10, but still not all of them can hit. So if I have like 2, which is an average, and my wife has an average of 50, and she has not been taking medication, and you're also having querying issues, then we delay to get babies. But it doesn't mean I can't have. It doesn't mean you cannot. There's a disadvantage of us women whereby you're like, now at this age I will not. Yet at a man's age at 50, 60, they can still meaning minimum. Because even there's a lady who was 50-something who produced twins. You get. So the minimum is 45 for women. The minimum for men is 60. But still there are those who can have kids after that age. You get. But if we've had these tests before, now we prepare. So when I see a bump along the way, I remember we did this test. So we're like, okay, I think we've delayed. Let's embark on treatment. Let's embark on emotional, because also our emotions as women pushes the eggs further. You get. It pushes the eggs further. Then also you need to know which is the right time to conceive. According to like a person who has been taking meds all my life, I didn't know I could get, actually when I got married, I think it was the first thing I looked out for, was like, do asthmatic people produce? Though before we got married, it was never really a topic, because I think he just loved me the way I was. He felt like, I need to be there for her anytime. It's raining, where are you? Why is it raining? Please go home. So for me, a person who has been taking medication, it was something I thought of, I think, after the first month. I'm like,
By the way.
But after the first month, I'm here thinking, and the 6th week, I find out I'm pregnant.
Wow.
You get what I mean? But for people, me too, I think it was just exceptional. As just exceptional. But there are people who have been sicklers and you're on medication. And conceiving becomes a problem because you have a lot of medicine in your system. You get. So if you have not tested some of these things, then you also find out that your fertility rate has also been affected because of the meds. And then you also find out your spouse's sperm count is also questionable. Are you seeing you're getting shockers along the way, which you could have prepared for
before? Wow.
Because, I mean, marriage is not all about having babies, biological
That's
babies.
true.
We can adopt. So if I find out that it will be a tug of war to have our own, then we prepare ourselves emotionally and financially.
Especially.
Because even adopting the kid is not free of charge. You need to invest in a lot to prove that your home is stable, to bring in another person, you know.
Yeah.
So if I found out that along the way,
or if you have to go for a surrogate, it is extremely
like even a
expensive.
surrogate, it's so much. Having to do all those tests until you get that. Because people do those surrogate tests for times and then they fail to work, they fail. So if we prepared ourselves like, okay, now I know this is the journey we are on, I love you, but we are going to walk this journey together. You have your bump, I have my bump, but we are willing to
put them together and walk this journey. So, Grace, now we are married.
We are married. We continue the tests. We continue the tests. If you have a history of any STD, continue the test.
So, if I get an STD and I'm married, should I tell my husband?
Yes. STDs spread faster when you're active in sex. So if you have a history of any of those funny things, it's very, very important now that you're active in sex to test. Because now your body, because this wall is being tampered with on a daily or every after 3 or 2 days, depending on your
activity rate.
Your hunger for these things.
But now some ladies or men actually either would say that when I tell my husband or wife, they'll ask me where I've got this STD from.
My friend, you tell him. So me, I'm insisting you tell. Why? Because if once you're found out you're sick and you tell your partner he's sick, you both take treatment and you both heal. Because STDs don't only come from using being unfaithful, even using dirty places. You get dirty places can spread the STD, can spread the UTI. Because now if you have a UTI and you go to a place where a person with an STD has gone, are you seeing how you're getting the STD? It doesn't mean I've slept with someone else.
But there's that stigma around it that some people end up saying, let me just treat myself in silence.
If you treat yourself in silence and you're active with your husband, he has it. And as soon as you've recovered, he has reinfected you. So clearly you're not doing anyone a favor apart from prolonging the death. And before you know it, then more diseases will come in around that area for a woman. Unfortunately for a man, it's outside. Now for us women, by the time it comes out to show, it has already affected your system. So we put these emotions aside, ayombe, say all
how
these
do I
tantrums.
tell the person? I was actually seeing someone asking, how do you tell your spouse?
Okay, there we have 2 options. Me, it would be easy, or it would also be hard from my medical history. One, because my husband knows the medication I take. If I know that it's hard for me to say something like this, he knows I take medicine, though of late I don't take because I have healed. Like I said, I healed in COVID. So since I don't take of late, if I start saying, please help me with that, can you buy for me this medicine? It's over. He'll be like, what medicine? Then before, men may not really, it may not ring a bell immediately. But when he's at the pharmacy,
he's like, why am I buying medicine?
Then they will ask, whose medicine is it?
Maybe for the children.
No, an STD medicine. It's not for the children.
So we should send them for the medicine. Please buy for me.
Please, because now, like I'm saying, I have 2 versions. I have that other version of I will call you and tell you, please can you buy for me this medicine?
Yes. And
then
that starts the conversation.
That starts the conversation. If the kajane is still good enough, he'll get mad, he will fuss, he will beat up, he will boil. By the time he reaches you, he won't slap you. he will have come down to want to know where you got
Where
it
you
from.
got it from. But at least the conversation
But
has been started,
which is
beautiful thing.
exactly. Now, if the other scenario would be, help me with that medicine. You've bought it already for yourself.
It's
Put it.
just on that.
Men love their wallets. Men love their phones. Put it in between his phones and his wallet there.
And then you ask him, please pass me.
And you're like, don't ask to pass me. When he
Eh.
comes to pick his phone and wallet, he will
You'll
see
find a
it.
medicine.
And then he will be like,
What is this for?
Grace, what is this? Is it for the kids? Who is sick? This is Wagenzo. And like, no, I'm sick. It's this and this and this. And you explain. So if you know you are clean and you're sure, you're truthful to yourself, you've not done anything wrong, there are other means of contracting the disease.
Yes, they are.
So
And
how do we
shouldn't
present
just-
ourselves? You just make sure you check where you know that it's either where I went to ease myself, like I said, we women, and we are active in sex, we easily contract any of these things. Don't be there and you beat yourself up and you're like, oh, they're going to say I am adulterous, they're going to say I am a loose person. No. Down there, the system itself is loose. It is active. Once you're active, you're prone to anything. And also there is this other thing. I have a colleague of mine, my friend had told me we were having this talk, and then my friend told me, that one, there's a time they broke up with their boyfriend because she kept on having these STDs all
there are
the
people
time.
who actually
All the
have
time
one.
she kept on having it, and I'm like, but she's active. Because for them they are not saved, they are Muslims. But then she kept on telling the guy, naye you, ozunga nnyo. Like, okay, kwa makono gwe mmanyi, ozunga nnyo. Like, it cannot be the talk we keep having. Like,
all
again,
the
I'm sick,
time.
again, I'm sick. And then the guy kept on even saying that, do you know nowadays it's only you? So
But
it's
she
you,
couldn't.
and she's like, you're joking, you're lying. Until one day, she goes to the doctor, and the doctor asks her, how do you clean yourself down there? So that's when I found out the doctor really short people. I stand to be corrected, but short people are prone to STDs, that UTI, more than tall people. Why? The distance between their V and their exit is shorter. Why? When you clean yourself, this is when she actually told us that, okay, now Muslims have a better advantage.
'Cause
They
they're always
wash.
washing, yes.
Now for you who is not a Muslim
And is
and
using
you're using tissue, then you sweat. Like I told when we had come, I told, don't touch my back, I'm sweating. I was in the car. You sweat, and then the sweat goes down. Now it's connecting the sweat from the exit to your V part. That if the distance is short, the sweat comes and cleans your butt properly, and it takes it to the V. So now these germs start eating up that place. It starts slowly today, after a month. That day you ease yourself where it's dirty, you contract it.
So
And these
poor
germs,
man was being blamed.
the poor man was, yes, because here is the thing. When they broke up, the lady stayed getting sick. And she's not active with anyone. So she's like, she calls the guy, she's like, again, I'm sick. I don't know, I'm sorry, I think I blamed you for nothing, but it was a real war in their relationship. So later on, she goes to hospital. Then that's when they told her, yeah, sometimes it comes, but now it has reduced because she has known that she has to
causes
be
it.
extra careful with her
Extra
body.
clean.
Extra cleanliness. Tissue is never enough. We can borrow a leaf from our brothers. Go with your mineral water. Clean there a little. We are women, even if you're tall, even if you're what. The other one is just an exception that they contract it easier.
But the contraction can still be
It can
there.
still come for us. I'm average. I'll not put myself there or the other side. So we still contract. We just need to clean
Be
that
extra
place. Clean it. And the more even us who put on like trousers, like a load, there is no air. We keep the whole place is always moist. Like there's no time your place is dry. Like it's always warm. The place doesn't breathe. So when from there you go bathe chap and you go and engage yourself.
So
Most
hygiene
times
is very
it's
important in health.
Me, I've actually learned that the days you interact with your spouse, after, go wash up. Especially if you know you're always contracting those diseases. As soon as you're done with the process, just stand up, go wash up, and go and sleep. Some people like just sleeping after, I'm
Just
living
so
the
tired,
moment.
yes. As the germs
As they're
are
living the
just-
moment, they are living
They
the
also live-
moment. So,
Even the germs are living the moment.
yes. So you need to keep hygiene, but you need to keep testing. It's important. Just go and do a routine test. Check. I want a full body check. Check me down there. Check. So that in case there is anything starting, you see it much earlier. You treat. And it's important whenever you go to the hospital, tell your spouse, I'm not sick, I just feel like, so that he gets to know that actually you keep doing these tests. So that in case something bounces out of the test, he knows that this one keeps doing these tests because just to prove that the last time when they took medication, did I heal completely? Has it come back? Did I just silence the disease? And then it had produced babies.
And yet Ugandans, we like self-medication.
Of course. But when you love your health, especially in marriage, than insisting, thinking your husband is cheating, yet you are the problem to yourself. You get. And even the men also, like it's important, in case you've contracted it and you've known, tell your spouse, my dear beloved wife, I think I'm sick. If you're not yet feeling anything down there, go check up. That is if you really love your...
Do they even get STD?
They do. I was trying to research about people who do circumcision. People say that if you're circumcised, my friend, they get sick.
Because they pick up things easily, because I'm thinking this skin is out of it. Like,
they get sick. Actually, they are called carriers.
Okay, they are carriers.
They carry and they keep distributing because they think they are immune. They are carriers. You watch out for those men.
So, okay, we need to go to the next thing. How do we handle health-related issues in our marriages? Maybe if there's a disease that comes in a marriage, maybe it can be one of our spouse or the children. How do we best handle such scenarios?
Okay. The best way I think to handle it is by not having a blame game, not playing the blame card. The easiest way I can maybe talk about it is briefly about my child, my second born. She's now 11, making 12. 5 years down the back, she was diagnosed with something I don't understand. It was they were calling it an abnormality in the intestines. So I'm a person who loves fasting. I love fasting. Why? Because in marriage, if you don't fast, my friend, you don't keep the marriage. Some people find it strange, but whether there are problems or no problems, you need to keep this. That's why they say marriage is kept on the knees. You get? Because once you wait for the bad times to go on the knees, it will be hard. It will be hard to keep on the knees. You'll have a breakdown. You get? So it happened when I was not so much a knee person, but I was a knee person. So my child was diagnosed with this abnormality in the stomach. And because of my fasting, Mr. thought I make the kids fast so the child has contracted something. Because of the fasting.
Yes.
Which was not the case. You get? So when something comes out as the blame game is what kills the marriage now. Once I start pointing and I'm like,
must be
it's you. It's you who didn't do your part. You will fail to even get the solution of the disease.
That's true.
You get? Like I said about the STDs, once you start the blame game, you both won't heal.
You won't even go to hospital.
You won't go to hospital. You keep, and then before you know it, just know, when you get sick, after like 5 months, don't you say that men take long to contract? Eventually he will get sick. And he will think you're doing something.
That's true.
But because you're quiet, he will start blaming you in silent.
He's also in silent.
And he's also in silent. You get?
The devil is speaking.
So here, like I was saying about my child, she got sick. It started as a joke. We are seeing lymph nodes everywhere scattered in her stomach. Lymph nodes are swellings that show there is a wound. Back in our days, lymph nodes would be under armpit. When you're falling down, you've hurt your knee, it comes here, or it comes in the foldings that can get. Those are lymph nodes. So if you see a lymph node in intestines,
meaning there is something.
They were everywhere in the whole, and they were over a space, they were as big as 2.5 mm. 2.5 is so big in children's intestines. Everywhere scattered, and it was alarming. And they were like, "Does someone punch this girl's stomach?" Because when you check her body, there is no wound. She's not telling you that here is hurting, but the only thing she complains about is my stomach. You get. So when this thing came out, at first he took long to blame me, but he eventually blamed me.
They're over fasting.
Stop this fasting thing. You make my kids fast. Now the child has gotten a problem in the stomach because she does not eat well. You get. Yet it was not
That.
so. Like if you keep out the blame game,
It's
later
easier
on
to find a solution.
it's easier to find a solution. We went to several hospitals. They would scan before they would first refuse to scan. They're like, these are kids. Why put on them these machines? What? But I'm like, you guys, we're in hospital taking medications so much, anti-acids, doing what? Manya ulcers, manya what? You know, you're treating things you're not even sure of. And I'm like, I insisted, can we scan the kids? When they scan, they're like, oh my goodness, what is happening? It was out, like it was alarming, you know. So after that big alarm, they're like, what has brought this? So we embarked on a journey of finding out what is causing. What does the child eat? Where does the child sleep? How does the child sleep? When does the child play? When does the child rest? When is the child happy? You get, it's easy. So then also minus that when you find out there is a solution, both of you put your heads together to look for a uniform cause. What do the two, if you're in a good healthy relationship, it's easy to know your person's schedules.
Yes.
So it's easy to know what was out of the schedule, the routine, you know. So when you find out that, okay, now we have this disease that has come up as a couple, like this other couple I was telling about of the estrogen imperfecta, those people embarked on the journey together. They decided we are going to love each other no matter what comes out. No matter how deformed that next child will produce. Because they wanted the kids. They're like, okay, so we know this, we are getting into this. Our kids may not be normal, our kids may be normal. So what are the odds? If they are not normal, what do? We love ourselves.
So
Then we laugh.
avoid blaming.
Yes, blaming.
other.
Because you know, you may want to blame someone. It's like blaming me for being not so tall. Like I have no control over this.
Over that at all.
However much you blame me,
And it won't change.
it will not change. I don't have a big booty. I'm just enough, just in Malavumanzi. So if you see me and you start asking, but why don't you have a big booty? Like, I mean, I do what?
I understand. So we need to stop blaming ourselves. We need to love each other.
We need to love each
As
other.
a team now,
Like I
especially.
said, it's not only love. There are several things that work in marriage. You look back at the core of things and like, why did I marry this person? Okay, I knew about the health. I knew about the background. What other benefits does this person bring to the
on
table?
Yes.
Does this person only complain, but do they add something to my life? They are not so good financially, but they are good with their brain. Their brains are creative. A disease has come in. How do we do it? Look at the positivity of the things this person has been bringing on the table before you start categorizing and impounding and expanding the disease that has come in.
Is too expensive.
We are always
should
treating,
just let
okay.
it die.
Yeah, we should let her die, but what has she been bringing to the table? There is the way the person gives you peace of mind. You get, that's just another factor, because the person may be good looking, and the looks, you would prefer a sick person on the bed
Than this one who's making
than this
you
one who is healthy, and then they are giving you headache. Because even the Bible says, staying with a person, it's better stay on the top of the roof. You get?
Yes.
So when you find out someone is sick, go back to the cause before you married this person. We are talking of health. Did you know about the health stand of the person? Or is it a shocker that both of you are actually shocked? Yes. We did our background check. We are both shocked. This has come up. What do we do? Now for me, when I produced, the first thing I asked, are my kids sick?
Because you knew that.
And when I got pregnant, I would not get attacks. Surprisingly, I would be, even the days of, I give birth normally, surprisingly. I am not, the machines be there waiting in case I pass out. Yeah, they do that. I be sober. As soon as I find out I'm pregnant, actually,
the asthma stops.
The wheezing stops, the attacks stop. They don't even see me in hospital, but I've come for nebulizing and all that. They don't. They only see me coming for the checkups. You get. But as soon as I've finished producing, like 4 months, when the baby is 4 months, that's when the attacks come back. There is a way God just protects my body like. Now imagine this person who knows and is having a breather the whole time I'm pregnant, won't we produce children until
You need to
we feel?
produce that 15.
Yeah? So as soon as I produced, I would ask the doctors, is my child sick? And then they would do those tests. Why? Because we have a history.
Because we know.
We know. So it's important to know. So that when you bring a child in this world, you know
what
that
you're signing up for.
this is what you're signing up for. Is the child sick? If the child is not sick, you monitor me. I would monitor my child. That days they would like, and they're like, no, it's just exposure to the coldness. No, it's not asthma. It's just this. My kids are all healthy, by the way.
Wow.
All three of them, they are fine. You get. So if you know, it's important. When you don't know, it's also good to check up. Do these checkups on your kids. So that when you know, it may be when you're a carrier or you're not a carrier, but still there are things that are recessive in generations.
Yes,
And there are
that
things
skip
that,
generations.
yes, and then it
Yeah,
just
yeah.
comes. You
Oh,
get.
interesting conversation, but sadly we have to come to the end of
Yes,
this.
yes.
What would be your closing remarks to our viewers about health in marriage?
Health in marriage. First and foremost, in case you're faced with a challenge, choose to love. It's important to choose to love the person the way they are, because health, you have no control over it. Just like the doctors, the best they can do is treat us, but they cannot guarantee that their medication is going to work. So choose to love the person, whether they are healing or not healing, and choose to stand with the person. But above all, put yourself in the shoes of the person who has gotten sick.
Yes, the pain.
And imagine, have some empathy and be like, okay, me, I'm sober, but what if I was the one who was sick? How would I want to be treated? And do exactly that.
Wow. Thank you very much, Grace
You're
Shana,
welcome.
for such an interesting conversation. I think we need part 2 of this, but it's really been beautiful having you with us, and our viewers, I think, can attest. Thank you very much for watching. As you've heard, health is important. There's a lot we've not talked about. That's why I'm saying we should have a part 2. There's a lot we've not talked about, and at some point you should also bring a doctor to actually break down some of these big words she was using to understand. But let us be as open as possible. Let us share love. Let us be able to tell these people, don't hide anything. This is your partner. Let them know what you're going through, and let us be able to share this information for for both of us to be better. If it is an STD, if it is malaria, let us share with your spouse as much as possible. Thank you very much for watching. I'm Fiona Mbowa here at Church of Uganda Family TV with Ring Diary.